Hi, my name is Arun. Uh, I've started a medical coding institute with name Loyal Academy. So I have more than 10 years of experience in medical coding with various projects experience. Currently, I'm working as a senior auditor in a reputed organization. So first of all, I would like to tell you what made me to start this institution is like uh, what I'm good at, I've decided to choose that my profession. So basically I have 10 plus of years experience in medical coding, and I have seen this field, and I've seen the growth and the stability in medical coding. So I thought it will give a good future for the students who are looking for jobs in medical coding. So this made me to start this institute. So I'll just want to give you a demo. Actually, this should be given offline, but because of few people's unavailability and the people who stay very far, so for them I'm making this video. If you have any questions, like you can ask me post this session. So what is medical coding? You might have heard this word coding in software jobs and all. Coding. What is the difference between software coding and medical coding? It's the same. Here it is a medical and the software job. The coding part is different. Coding. What is that term means? You are assigning some code to hide the information. For example, if you go to any supermarket, if you take any product, when we go to the billing counter, he will just scan that barcode, so that you'll get the price and you'll pay that amount and you'll come back from that shop. So why that barcode? What is the information in that barcode? We don't need that. Buyer and the seller, he don't need that information, but the manufacturer who is manufacturing that product, and the retailer or the who is buying that product will know that information, but they want to keep it secret, that no one should know that information. The same way in medical coding, we are hiding some information in the form of alpha numeric codes. Means you'll have both the alphabets and the numeric letters in that code. This is how we code in medical coding. What is the difference between medical coding and other coding? Like medical coding is purely, we work for the doctors, we work for the hospitals. See, medical coding job is actually, it's a job in hospital in abroad, whereas in India we work in MNCs, but this job is purely in a hospital actually. In Abu Dhabi, US, Canada, wherever you work in other countries, it is a hospital job. You have to work in a hospital. So what is medical coding? I just want to tell you. See, I'll take one country, US, because majority we work for the US doctors only in medical coding. Very rare we'll work for other projects. So in US, the country or the president or their government has decided like every individual should have an born individual should have an insurance mandatory. I mean health insurance. There might be two reasons for that. One is they might be much concerned about their citizens, and second is like in US medical treatment is highly expensive. It's not possible to afford for that. See, we in India also, when few people will go for US for treatment, only the VVIPs go for that treatment. Normal people they can't do because of high expensive. So maybe that for two reasons they made it mandatory. Whereas in India we have an option. We either choose medical insurance, or a few companies. Suppose if you work in an organization, they give mandatory insurance, like they'll deduct from your salary, but you will not opt for that. Or else our parents are like that. We will choose some LIC, some other medical insurances for our safety, but we choose. But government, there is no force from anyone or any government on this. So it's clear, like in India we don't have that mandatory insurance take up, whereas in US it's a mandatory. Every born citizen should take insurance. So just imagine if you have the medical facilities free and you are paying the premium every month because of mandatory insurance in US, and the people are very much concerned about their health. Like, see, if they get a scar on the nail, light little scar on the nail, they'll go to the hospital, and they for them money, time is money. And if they go to hospital, they, if they book an appointment, the appointment that on that particular date and appointment, they should get treated by the doctor, because there will be no delay or any they will file a complaint, because for them time is money. So in this flow of patient, just imagine how many flow of patient for a particular doctor in US, and the doctor will not get payment from them. What is like, they will adopt, however the government have could put a pressure to have an insurance to everyone, right? So what they will do in US, how they get treated, how the doctors are benefited with that treatment, what is the role of medical coder, you should know that. So two things you have to know in this medical coding, two terminologies to understand. See, in US, if we sorry, in India, if you do any business, we just say how much money we are earning, how much business we are getting, the term what we use. Whereas in US, they count the money in revenue. They will say how much revenue I am getting, how much revenue is generated every month through this medical treatments. So revenue, the word you have to use in this. And the second is like, here we call doctors who treat patient, whereas in US they call providers. So two terms, one is providers are called doctors in US, and the second one is the revenue, what the business where they are doing in this healthcare, they call it as revenue. So I'll explain you how the business runs in medical coding and what is the role of medical coding, medical coder. I'll take the printout of that and I'll share you. So here whenever a patient go to hospital, we know in India what we'll do. We'll go to the reception. Here also few people will have the insurance, no employees. What they will do, they give their insurance details, and once the reception person or check the insurance whether it is active or not. Once it is active and if we are eligible, what they will do, they'll give an appointment to us to meet the doctor. So we'll go to the hospital, and there we get the treatment, and the money they will get from the insurance. For that also, we have to give proper documents what we have and all. Here we'll do that the same, right? In US, what will be the procedure? The same. The patient go to the hospital, and he will give the whatever the active insurances he have, he will submit in the reception, and the reception person will check that insurances details from that patient, and if she found that is active, she will just allow that patient to the doctor. Here the doctor treats the patient, and the patient will leave from that place. The patient has no concern of that doctor payment and all. He will just give his insurance details, and he will get treated from the doctor. Now doctor has to get money from where? Insurance. If doctor want to get money from the insurance, he should tell to that insurance that the patient has rendered the service from me. But what information will be there in medical in with doctor? He has the information of the patient. Suppose the patient is treated for any fever or any chronic diseases, he will come to the doctor. He tells what disease is has, and the doctor diagnoses that disease. He treats the patient and he will send him. So he'll have the all the medical records and the active insurance information from with doctor. So, is it easy that a doctor can share his some patient's personal information and his diagnosis to the insurance? No. Will the insurance know have any knowledge of medical diseases and all? No. They just pay the amount. If the insurance is active, they just need that bills. They have some software with the insurance. For this procedure, pay this much amount. For these diseases, pay this much amount to the doctor. But is a doctor or any doctor can transfer some any patient's medical record information to the third person? No, it's a big crime in India or in US. Especially US, they are very sensitive people. Like if you transfer any information of someone's personal information, suppose he has some cancer, HIV or some like anything diseases, if the other person know that, and if he read his records and say that this person has this disease, and they might commit suicide also. They're such sensitive people they are, and it's confidential. That is not supposed is a professional. Like you shouldn't transfer any patient demo details to any third person. So how the doctors get payment? So here the medical coder comes. Here the medical coder job is a main job. This only medical coder knowledge is different from entire healthcare industry. What it does is like he will done certification in medical coding, that is like CPC, certified professional coder, or any CCS, C certified coding certified specialist. Like there are a lot of certifications in India. So majority like we do see CPC. So we do this certification. So once we do certification, this is an exam conducted by AAPC. It is from American author organization which conducts this exam, or AHIMA. These are American organization. They only conduct the exam, and we get trained, CPC trained, the medical coding people trained from the training institutes, and very few organizations they will give training in their or reputed organizations. So we get trained and we are certified. Our name will be registered in AAPC website that this person is a certified coder. Once you get that certification and you are certified coder, then you are authorized to take the medical record from the doctor. Then the doctor will give that medical records to you. What your job in that? It's a very simple job. We have three books. I'll share you the photos of them. One is ICD, one is CPT, one is HCPCS. HCPCHS, HCPCS. So what is ICD, CPT? What is HCPCS? Don't panic. It's simple only. What is the procedure? What is the procedure done in an hospital when a patient goes to their doctor? First, the doctor diagnoses the disease. So one book will be the list of all the diseases in the world you'll have. You have to code that diseases whatever there in the medical record from that book, open book, which is alphanumeric code. Why you have to give that code? Because to hide that medical record information from these insurance people. You need just payment. You can't share the patient records to the insurance. Just you give the code and the insurance people will have the payment information of that particular code. They'll give the payment to you. That's it. For that reason, the coding is very important, not to hide. And the coder plays a major role in the entire healthcare industry. Here is a second highly paid person after the doctor. I mean provider. So One book you'll have the ICD list of all the diseases in the world. First, the doctor diagnoses disease, you'll code that. Later on, if you diagnose the disease, what he will do? You'll treat the patient, right? You call it as procedure. Procedure we call we have a book called CPT, current procedural terminology. You'll code a code from CPT book. The procedure you'll code. So how many you have given the codes? One is for diagnosis, the doctor identified. One is the procedure. And you have the modifiers, place of service, whether the service render in hospital, whether service patient is inpatient, outpatient. That all you will learn when you get this uh, when you enter into this medical coding training. So it's an open book exam. Nothing you have to by heart, nothing you have to remember in your mind, nothing you have to struggle for this job. To write an exam, it's an open book exam. To do the job, it's an open book job. So nothing to keep in your mind, nothing to by heart anything. And don't take it like you can just search the book by your own. For that you need some training, you need the concept. If you know that concept, you can crack your exam and you can enjoy your job. See, this course can be given crash course for 10 days, 15 days, but only clearing CPC is not important. You have to enjoy your job. To enjoy your job, you should have the knowledge in that. With my experience, I can say that if you go through a training session for 45 days, for 1 hour in a day, then only you could able to complete this complete portion and you could able to crack that exam. Apart from cracking that exam, you can you can enjoy your job. And this is what the medical coding. Once we assign the codes for that diagnosis and the procedure, you will send that where you will assign, there will be a claim form. So if every insurance, they will give some claim forms for it to claim that diseases or payment. You just enter in that claim form. Your work, your job is that much only. Later on, there will be a billing department which bills that claims to the particular insurance. From that, the doctors are paid. If doctor getting 100 rupees as a medical coder, we have a contract with that. With this organization, will have a contract with that doctors. And in that, suppose I am telling you 100 rupees, $100 for example, he will give some $10 to you. This is the business of medical coding. You might have asked, no, you might ask this question: why can't doctors claim? Why medical coding team come into in this middle? Only one reason: flow of patients will be huge, and doctor cannot leave his hospital, and he can't go to that insurance companies. He can't, because they are very busy and flow of patients will be more. So medical coding business will never stop. And one thing, only experienced people know this. Like a few years back when COVID has come, there were rumors that coding might become automation or artificial intelligence. What is automation, artificial intelligence? Few people might know. See, nowadays robotic and advanced technology. You might ask me, Arun, see, if there is a artificial intelligence and it can self code diseases and procedures from the medical records, then what is the use of medical coder in this? In future there will be no security for this job. This might doubt you might get it. For that, I'll give a small example. In medical coding, it won't possible for automation. Without coder, you can't run this business. Why? I'll tell you with a small example. I got the chest pain here, chest pain, and I went to hospital. Will the doctor know by seeing just outside nothing happened to you? Will he say, or he will just tell, okay, you are getting the chest pain, you need to go for ECG, right? So ECG will be done. I'll tell disease diagnosis is like chest pain. I came with a reason of chest pain. And diagnosis procedure, what the procedure he has done? He has done ECG, electrocardiogram. In ECG, you got the impression. You might have seen that ECG report no, in your lifetime for anyone elders in your family. Reason for the visit, he will mention some chest pain. In impression, down, you will see if there is an abnormality in the ECG, there will say that AV node or some abnormality in the ECG. Or suppose if you find any block for elderly people, they will say arterial block or ventral blocks or maybe block will be there some. For that you need to do a stent or bypass surgery and all. Suppose, okay, you will tell the automation or robotic advanced technologies to code from impression. By using of these coders, we can run the business for automation, and that robo will code from that impression. Block is there, it's fine, and you will get the payment. There are no need of coders here. What if in case like the ECG is normal? ECG is normal with some, he might came from with some gastric or any some problem, or he slept in a wrong posture. So anything might happen. For that reason, if he get any pain, he might have come to the hospital. At that time, what you will tell with the artificial intelligence robo with code from impression. If suppose you will take, if you code from reason for visit will be the chest pain, and the main suppose you have a block, there will be a confusion. Artificial intelligence cannot take that step. Here the coder is the main role. He has to decide, because for chest pain the dollar amount will be very less. If the doctor identifies a block, that diagnosis amount is huge, very high. For he has to pay it for that amount. If you keep the artificial, it might code the reason for visit, or it might from code from the block. If the patient is came for the chest pain and the ECG is normal, then what is the use of coding from the impression? At that time that we have to code chest pain. For chest pain also there is an amount for the doctor. So artificial intelligence will not work in medical coding. You have to, medical coder has to be there in to run this industry. And I'm telling you, they're the second height paid professionals in them. And I'm telling you, it's a white collar job. In US, the insurance is treated as the second grade, like president, like that. In the same way in government, insurance employees are called the second grade, and we are working with that great people in US, and we are communicating with them for the payment. So this is what about this business of medical coding. This is how we run this. So what you need to do this, get a medical coder job, and how the growth and what kind of placements you have. See, I'm an example, like this my 11th year in medical coding. I never seen there is no like stable salary in my entire life. Every year I have seen minimum 20%, 30% of hike in my salary, and the same the positions also gets changed. And when I started my career in Hyderabad, there were 4 to 5 companies. Now in only Hyderabad you have almost 200 medical coding companies. Just you'll see the growth. You can if you want to search in Google, you can. And I'm telling you, it's never be an automation job, it never be an uh, artificial intelligence job. So medical coder job is secure. And we know all that. Will hospitals get failed? Until we live and we die, we often go to hospitals. Until hospitals are there, medical coding job is there. You may, software may fall, but medical coding job will not fall. And what about the salaries? You can ask me, like, see, for a certified fresher who done the CPC certification, companies are providing them 35,000 gross salary, and they get a 32 to 33 take home in good reputation companies. So this is a fresher job, and if you done 1 year experience in a particular organization and you were well trained in particular project, and if you want to move some other company, definitely you'll be getting more than 45 to 50,000 of salary. This is the growth. Every year you'll get minimum 25 to 30% of hike. This is what the growth in salary wise. And regarding the placements, you can work in India. If you don't want to work here, you can apply for Abu Dhabi, you can apply for Canada, you can apply for US, you can apply for any country where the medical coding boom is there. You can go there with this certification and experience. And in India, there are a lot of companies in Chennai, Bangalore, Hyderabad. See, huge openings. Once you are certified, no one will stop your job, because your name will be registered in a American as the AAPC website, and the HRs of all the companies will have the access for that, and they will take your number from there. You just see, once you get certified, how many calls you'll get to for an interview. And this academy, what I started, I got tie up with the 12 companies, and 100% placements I'll provide here. And without placement and without passing of certification, and if you fail in anything, and whatever the amount you have spent here to me or your exam, 100% I'll refund you that amount back. Because that assurance, with that confidence, we have started this insurance, this institution. So don't worry of that. And online and offline classes we conducted. So offline will be, I'll sharing the address to you, and online will be, right now we are doing from 9:30 to 10:30. So this tenure is 45 days, and 15 days will give some mock test. So 2 months you have to prepare for this exam. And after these 2 months, if you will check the confidence levels of from your mock test, and will give you an attempt to write this exam. You know, this exam is a 2 attempt exam. If you fail in 1 attempt, you can go for the second amount with the same fees. So with the same fees, you can give the second attempt. So majority, like I have seen, the people who are non-science background also crack this exam, are in good position in my industry. I see BTech, MBA, are there in higher level position in my organization. So it's no need to worry that it's not a difficult job for them. And regarding to that fee structure, you can check in the market, like for online classes they will charge to 50,000, and offline charges they will charge some 35 to 40,000. But we are starting this institution, so uh, uh, we just want to start with a good start. So I have hired the faculty also in order to pay them and few the rents. And we kept for 15,000 online and offline. So for institution fee, and the exam fee, it's nothing institution gets from that, or no one will take amount from you. You only we have the corporate account. If you pay from your credit card or debit card, you might lose some 2 to 3 thousand, because you might not have that corporate account. So we pay, if we pay, no, then you'll get reduced. It will be like 250 $300, like that every year. The dollar value will change, so that amount difference will be some 500 to 1000 difference will be there in the examination fee. Roughly it will be like 46,000, 47,000 of exam fee, CPC exam fee. And institution fees 15,000 for 2 months, until you get certified. That is the fee. And uh, apart from this, like if you have any questions and all, our intention is to not to earn, or everyone needs money. I don't say that money, no one will say I don't want money, but everyone. But that is not the main intention of me in this. Let the knowledge get shared to everyone, and people who are seriously looking for their jobs and who are struggling for their jobs, I can guarantee them that medical coding is a good profession, and it's a good life for any individual, especially girls. And it's a very secure job. There will be no rotational shift. It's a complete day shift. You can work either 8 to 5 or 9 to 6 as per the organization rules, and there will be fixed Saturday Sunday week off. And there will be no stress. You'll enjoy the job if you have a good training here. And you can take the experiences of the other people who are in the medical coding, ask them, take their opinions, then only decide your career, because career is the most important step to choose when you enter into some field. So do a background check, inquire with the people around you who are in working in medical coding, ask them whether this field is good or not, then only you take the step. And I've taken more than 30 minutes. I might miss few topics, but majority I have covered. If you want to ask any questions, you can post me below this video. And just I'm saying how much amount they, suppose you keep some 40 to 46 to 48,000 for exam fee, which you are paying for the AAPC website. So apart from that, institution 50, like around, suppose if you take 50 or 15, 65,000, 65,000 you are spending for this course. Suppose you think in that way, that is just the 2 months of salary you're gonna get once you get certification. So any code, any person who want to do a medical coding, they have to get certified. For that reason, the certification is a course is there, or else if they ask us to trade, just send the freshers. You no need this institution, you can directly go for a job and ask them, but you'll be paid very less for freshers, 10,000, 12,000 salary in market. Once you're certified, your package will be good, and your recognition will be good. So this is what about the medical coding. Initially, people might be thinking like 65,000, 50,000 for exam, 15,000. It's a big amount like that, but it's equal to your 2 months of salary. And once you certified, I'm giving assurance that you will not stay idle, not even 15 to 1 month. You'll be getting any job in any organization in Hyderabad, Bangalore, Chennai, anyone. And there is an option for work from home also. Once you, as per the company requirements, few companies from Bangalore, Chennai, they are preferring work from home individual throughout India. And we have contact with that companies also, we'll let you know. But think before choosing this career. And we grow in this coding life. So I suggest only with my experience. I'm not just telling with 1 or 2 years of experience. I almost in this field for more than 10 years. So I've seen the growth, I've seen the stability, I've seen the success, and see the growth of organizations, growth of individuals' life, and well settled people in the medical coding people. So with that experience, I came forward to spread this news of medical coding profession to everyone. Thank you. You have a nice day.